You need your calming drink. Let's just sip together. My name is Carmela DeGracia-Patton. I am a kinesiologist, so I am an allied health professional, and my job is centered around helping people with chronic conditions better their state by working with them to change their behavior so that they exercise more and positively impact their health and hopefully decrease their chronic disease.
How did you come to work in healthcare?
I was always fascinated by the human body. I went to university starting with biology, realizing I didn't like plants or fish that much, but I loved bones and muscles and followed that path, and it took me to kinesiology. I've always tossed around the idea of being a medical doctor, and I think that's something I still really want. But in the midway, I found kinesiology, and I really love moving my own body. I've always been active, and it just seemed to be a right fit. Whenever I interact with patients, again, and this ends up being an older demographic, they always try to identify what I am. Ooh, they'll say like, may I ask, where are you from? Or, are you this? Are you Filipino? Are you Mexican? Are you? And as soon as I say, yes, I am, or yeah, my family's Filipino, they often make reference to other Filipinos they know, and they try and stereotype me, and sometimes it fits and sometimes it doesn't. So do they treat me differently? I think in general, the outlook of Filipino people in Canada is positive, very giving, very hospitable, so it never negatively impacts me. But again, I'm always fascinated by why I have to be typed that way when someone first meets me. Filipinos are commonly nurses and care aides and more primary healthcare professionals, but in the allied health, it would be nice to see more of them break out into that sphere, and I don't know if they feel like that's an option or not, but I haven't seen very much change there. I would like to see more of that appreciation for Filipinos in healthcare. I think they make up a large chunk of the workforce, and I think sometimes that goes unrecognized. And also, at the same time, not confining them to this domestic care role. We have so much to offer, and I hope that people got from my mom's segment that people come here with different educations and different skills, and sometimes I don't feel like they're given the opportunity to really express that at the cost of assimilating and making it. So try not to put the Filipinos in a box, and just know that you're probably talking to someone with a lot of skills and a lot of knowledge, and give them the space to show that